Chapter 25, Anger and Aggression. Okay, one might think that anger and aggression is the same, right? But what is the difference between those two? Anger is a normal emotional response to a perceived threat, frustration, or distressing event. It can be focused on the self or others and might be associated with some kind of anxiety and some loss of control. And sometimes people are actually using this as a coping mechanism. Now, what is aggression? Aggression is a forceful attitude or action that is expressed physically, symbolically, or verbally. So anger can actually anger may result when the basic needs are not met, right? For example, a person that has not been eating, right, very hungry, that is a basic need, might actually be angry, right? Um, or a patient that actually did not get any sleep, which is another basic need. Patient is not going to be in a good mood, right? There might be some kind of anger. When you look at the continuum, another continuum of anger responses that will be in page 289, we can see, like the self-concept continuum that we did talk about in chapter 24, the continuum of anger responses, these are actually learned behaviors. So could be passive behaviors, right? Or the anger is felt but not acted on. That is what you actually want when you have that adaptive response. Or if you have that maladaptive response where there's always a loss of control, right? Aggressive behaviors, okay? So it could be maladaptive or it could be an adaptive response based on what actually the patient have learned, right? Learned skills, learned behavior. Okay, now let's talk about the terms that is relating to anger. Okay, in page 289, box 25.1. So, acting out, passive aggression, violence, assault, and battery. And what are they? Acting out is the use of inappropriate or destructive behaviors to express emotions. Passive aggression involves indirect expressions of anger through subtle, evasive, or manipulative behaviors. The keyword there is indirect, right, for your passive aggression. Violence is behavior that threatens or harms other people or their property. A violent act involves actions of force that result in abuse or harm. Assault and battery. Assault is a legal term that describes any behavior that presents an immediate threat to another person. Keyword is threat to another person. Battery is the unlawful use of force on a person without his or her consent. Keyword is the unlawful use of force, right, on a person. Okay, now assertiveness, also one terminology that we need to remember, is the quality, is the ability to directly express one's feelings or needs in a way that respects the rights of other people yet retains one's dignity. We call it assertiveness, okay? All right, so for anger, the manner in which a person actually will express anger depends on what we call impulse control. What is impulse control? Is the ability to express one's emotions in appropriate or effective ways. Okay? All right, anger and aggression in society. Cultural expressions of anger differ. Again, let's go back to cultures, right? Um, one culture expression of anger is going to be different than the other cultures expression of anger. For example, we have cultures that would actually be very loud, and it's actually okay to verbalize their anger in like a loud voice, right? Some cultures are like that, and then some cultures would actually be quiet, right, if they're actually very angry. So cultural expressions, they are different in every anger expression is very different in every cultures. Okay, now gender aggression. What is gender aggression? Very important for us to know. Ancient and well accepted beliefs that men were superior, right? For your gender aggression, this is a belief that men were superior, led to values that supported the abuse of women. Okay, that is called gender aggression. And yes, gender aggression and abuse, they are still practiced everywhere. Even though it's not acceptable now, especially in the United States, right? But you can see that it's still being practiced everywhere. Okay, aggression throughout the life cycle, expressions of anger begin in infancy and end with death, and it's true. For example, the infants. How do they express their anger, especially when their needs are not being, when their needs are not being met, right? What they do is they're going to cry, right? Crying is how the infants are actually talking to us or communicating to us. Um, so this is how they express their anger, right? And then toddlers, how do they do the expression of anger? They engage in temper tantrums, right? Children in the early school age years, they may be expressing their anger through assault or even hit each other, right? In adolescence, fighting is more organized, more controlled, and purposeful, okay? They're not just like the toddlers who's just gonna throw tantrums, or children even who would just hit um, other people and have that assault even though they don't have that um, concrete reason. In adolescence, the fighting is actually more organized. The emotions and the aggression is more controlled, right? And the reactions, they are more purposeful. Okay, now after 45 years of age, few people now engage in physical aggression. Okay, so why are we talking about aggression throughout the life cycle? It's very important to know so that we would know if this is actually um, what you're expecting as a normal developmental stage for a patient. For example, you're taking care of a, let's say, adolescent, right? And you could see that there's like some aggression in the adolescent patient that you have. So expectation is that their fighting is organized, controlled, and purposeful, right? You do not expect an adolescent to actually be throwing temper tantrums when they are feeling that anger, right? Okay, so that's why it's important for us to remember and to know aggression throughout the life cycle. Okay, scope of the problem today. Aggression and violence are worldwide concerns. In the United States alone, 4,266,000 violent crimes were reported in 1999. How much more now that we are in 2024, right? Helping others focus their aggression into more effective and less violent ways of coping is the task of a healthcare provider. And that is actually what we're going to work on with the patient that has this anger and aggression. What we want as healthcare providers is to help them, educate them, and train them of ways of coping, effective coping, and so that they can focus on that versus focusing on their anger and aggression. Okay, some theories of anger and aggression. We have some biological theories. Again, biological is always something to do with the chemical balances, right, in the body. Models that see the cause of aggression and violence as physical or chemical differences, we call them biological or individual theories. And some of them are Charles Darwin and Sigmund Freud. For Charles Darwin, he used the animal model that stated that aggression strengthened human beings through natural selection. And then for Sigmund Freud, he believed that the greater the death wish, the greater is the need for aggressive behavior. So, in other words, those people that actually don't have that great death wish, they're actually the ones that are actually behaving or not having that aggressive behavior, okay? Also, things to remember, aggressive behavior is explained as psychopathology, right? A disorder in the biological or physical makeup of the person. And for the biological theories, they believe that the roles of some neurotransmitters are being investigated as possible factors in the development of violence itself. You have your psychosocial theories and social cultural theories. Psychosocial is of aggression state that aggressive behaviors are learned responses, right? Psychosocial always something to do with the environment, right? Um, Learned responses. So, for example, if maybe a child that actually was like grew up in a household where everybody's fighting, so that you could see that for the psychosocial theorists, they believe that when they grow up, then there's like a high risk that the patient is actually having that kind of aggression or aggressive behavior. Sociocultural theories is cultural theories state that aggressive or violent acts are a product of cultural values, beliefs, norms, and ritual. All right, now let's talk about the 5 stages of assault cycle. 5 stages of assault cycle. All right. Hmm. So again, assault is aggressive behavior that violates another person or another person's property. Okay. Studies have shown that assault and violence occur in a predictable pattern of emotional responses, and we call this response pattern a stage. Okay. There are 5 stages in the assault cycle when we're talking about assault. You have the trigger, the escalation, crisis, recovery, and depression. And please know these 5 stages in the assault cycle because we need to know. For example, if you're being given a question that is actually giving you a scenario where maybe a husband actually is abusing the wife, and then now they're actually at the stage where they're hitting each other. So what stage in this 5 stage is this couple in, right? That's how they're gonna ask us. Okay, so know the 5 stages in the assault cycle: trigger, escalation, crisis, recovery, and depression. All right, the trigger stage. What's the keyword for the trigger stage? This is when there is a stress producing event that elicits that emotion of anger, fear, anxiety, or a similar response. The client chooses coping mechanisms in an attempt to achieve control. Okay. The client's ability to solve problems or use nonviolent behavior decreases as aggressive feelings escalate. So, when there is a lack of effective coping mechanisms, that's when an assaultive behavior becomes automatic. Okay, someone's gonna hit someone, right? Okay, crisis interventions are very successful if we begin it early in this stage, in the trigger stage, right? So patient or the assault is still in the trigger stage. Okay, as a healthcare provider, it's very important for us to help the patient to identify. Our goal is to identify triggers and then learn alternative or positive or good coping behaviors, so that we can help the patient actually not go to the next stage of the assault cycle. Okay, now escalation stage. This is what we call also the building stage. Okay, each behavior moves the client a step closer to a total loss of control. The aggressive behavior will become increasingly ineffective in regaining control. Frustration and anger increase, and then there's going to be an intense emotion that makes the aggressive or aggression escalate. One main reason or one reason that could actually contribute to the escalation stage is, and that we see actually in as a healthcare provider, is the influence of drugs or alcohol, right? When the client is under the influence of drugs or alcohol, this actually enhances the loss of control and makes our intervention actually more difficult. Again, intervention is crucial, very important, if we can do it as early as we can, right, in the first stage. But in here, intervention is very crucial if violence is to be prevented, and that is actually our goal. Your keyword here, frustration and anger actually increase, right? There's a building stage. All right, now crisis stage. This is when the potential for danger increases, and this is when the assault behavior actually occurs. Okay, assault behavior occurs acting out in many forms, doing physical harm to others, abuse or torture of animals, or destruction of property, or it may even be just a verbal abuse, right? Screaming, shouting, cursing. That is a crisis stage. So, very important for us to remember, at this stage, our clients are not listening anymore, right? They are unable to listen to reason, they are unable to follow directions or even engage in mental exercises. They completely lost control, right? Okay, so intervention here is very hard now, okay? Um, However, the goal, if we're talking about intervention during the crisis stage, is to protect the individual and others from physical harm. Okay. All right. Now you have the recovery and the depressive stage. What's the difference? The recovery is the cooling down period. This is when they're starting to cool down after the crisis stage. Okay, client slowly calms and returns to normal behavior responses and actions. Interventions include assessing for injury or trauma and providing a safe, quiet environment where the client can actually cool down and recover. Okay, you have the next one is the depressive stage, which is when the client now feels that guilt and maybe even attempt to reconcile with others. This is the stage when the assailant actually may offer loving care to the victim. Maybe buy them flowers, say sorry, right? Say, I love you. I'm not going to do it anymore. Okay. That is the depressive stage. And then as time passes, the assaultive event is slowly placed in the past. Also for the recovery stage, for the recovery stage, it can be the patient will be physically and emotionally drained. Okay, for your recovery stage, physically and emotionally drained. For the depressive stage, this is very common for those patients that actually is a victim of domestic violence, for example. This is the stage where the assailant is actually trying to make up for the things that they did. And for the victim, it's actually very confusing and dangerous for them at this stage, okay? The assailant will actually maybe promise to never repeat their actions again, right? And displaying all those romantic and they're trying to reconcile. So for the victim, it's very confusing stage for them. Right, anger control disorders. We have conduct disorders, impulse control disorders, and adjustment disorders. Conduct disorders, these this one actually most often occur in childhood. Impulse control disorders usually develop later in life, and adjustment disorders can occur at any time. So, conduct disorders. This is a pattern of behavior whereby the basic rights of others or major age-appropriate societal norms or rules are violated. For example, this patient will bully other people, right? Or they will even be physically cruel to an animal, right? So these are conduct disorder. And then you have oppositional defiant disorder. This is when there is a pattern of negative, aggressive behaviors that focuses on authority figures in the child's life. Okay, that's your keyword for your oppositional defiant disorder, is that they have a problem with authority figures in their life. Okay, and these children, they are easily annoyed, resentful, and irritating, and they often lose their tempers and blame others for their misbehavior. Okay, this is usually seen for your oppositional defiant disorders, usually seen by age of by 8, and very important for us to be addressing it early. Otherwise, if we don't, this behavior can actually turn into a conduct disorder. Right, then you have impulse control disorders. So please know this. This is in page 294, box 25.2. Those are examples of impulse control disorders. And what is impulse control? When the individuals actually fail to resist an impulse or that drive or temptation to perform an act that is harmful to themselves or to others. So some of your example is your kleptomania, right? Kleptomania is an impulse to steal objects when they are not needed for personal use or survival. It may be pathologic gambling, right? Maladaptive betting, wagering, or gambling. Pyromania. What is pyromania? There's a pattern of starting fires for pleasure or gratification. And then you have trichotillomania, which is the pulling out one's hair that even results in a noticeable loss. Then let's go back here. Your intermittent explosive disorder. This is when the individuals fail to resist aggressive impulses that result in the destruction of property or assault on another individual. Okay, adjustment disorders. These are emotional or behavioral problems that develop in response to an unidentifiable source. And individuals have difficulty adapting to a new situation and may even attempt suicide. Okay, suicide attempts occur more frequently in persons who are having trouble adjusting to new situations. That's why it's called adjustment disorder. All right, please look at page 294, box 23, 25.3. These are types of adjustment disorders. You have adjustment disorder with depressed mood, adjustment disorder with anxiety, adjustment disorder with mixed anxiety and depressed mood, adjustment disorder with disturbance of conduct, and adjustment disorder with disturbed emotions and conduct. Assessing anger and aggression. So when you're doing the assessment, we are actually going to do a mental status assessment, is what we call it. What are they? There's the general appearance of the patient, activity, behaviors. Are they still safe, right? Are they throwing chairs at somebody else now? Or, are they screaming on top of their lungs? Okay. Attitude, verbal communication, mood, affect, perceptions, thought, judgment, and insight reliability. Then after that, you're gonna do your psychosocial assessment, right? You're gonna ask more questions. Know about the patient's coping skills. Is it actually an adaptive or maladaptive? Um, do they have good relationships, like good support system? Cultural, spiritual, occupational, value and belief system, reactions, behaviors, and attitudes. Okay, therapeutic interventions for aggressive um, clients, they occur in three levels, and we need to know them, okay? They occur in three levels for the interventions for aggressive or potentially aggressive client behaviors. Level 1 is when the interventions focus on the prevention of violence. Okay, prevention of violence. Level 2, interventions focus on protecting the client and others from potential harm now. And level 3, the interventions are reserved for those clients who are now out of control. Very important to remember. That's why we talked about therapeutic communication, therapeutic relationship with patients. This is very important because this is when we're actually going to be able to have the therapeutic interventions for our patient. Your level 1, level 2, level 3. Okay. Therapeutic interventions include establishing good communication, learning to identify the signs of potential violence, and providing a safe environment when a client is out of control. Okay, guidelines for interventions. Interventions for caregivers focus on learning to effectively control their own feelings of anger. Even the most therapeutic care provider experiences anger. And it's okay, like what we said earlier on, anger is normal, anger is a part of our emotions. However, we just gotta learn how to actually use that coping mechanisms and skills to actually adapt um, to the situation, right? Learning to cope with personal feelings of anger and aggression allows caregivers to be more successful in working with the angry emotions of others. And let's look at box 25.5 in page 295. This is how we actually communicate with angry patients. All right. Now, first, Take a deep breath and become calm. You cannot be yelling while the patient is yelling. Okay? You're the healthcare provider. You're the one that needs to take control. If we see that the patient is actually losing that self-control, it's up to you. You're the healthcare provider. You're the nurse that's taking care of the patient to have that control over the situation. Okay? So again, first, take a deep breath and become calm. Introduce yourself to the client. Speak slowly, right? Hi, my name is Salvi and I'm your nurse for tonight. Okay? And then what are we going to do? We're going to listen actively, right? Use active listening skills to communicate your interest in helping the client. Allow the client to define the problem that is causing the anger aggression. When we say listen actively, you listen actively. You look at the patient's eyes, right? You're not typing in a computer or you're not writing in a paper, right? Your eyes should be looking at the patient, okay? And when the patient is talking, you listen. You don't actually overtalk the patient, okay? Listen actively. Now, identify emotions. You try to understand what is causing the problem and why the client is reacting with anger. Ask yourself what the client may be feeling and verbalize it, saying, you must be feeling quite sad, or you must be feeling, or how do you feel about that, right? Allows the client to identify and discuss his or her emotions or problems. Then explore options. Help the patient to regain some sense of control by brainstorming possible solutions to his or her problems. You may not be able to solve the problems, but you can assist the client in finding his or her own solutions. And then offer positive comments. Increase the self-esteem by finding something the client does well and complimenting him or her. Many clients and their loved ones feel helpless, and the reassuring words of a concerned caregiver can provide great comfort. Right? Okie dokes. Question number 1. The nurse is taking care of a client who consistently pulls out her hair. What is this behavior? Answer is 1. Trichotillomania. The assault cycle consists of 5 stages. A stress-producing event occurs during which stage? Answer is 1. Trigger stage. The potential for danger is at its peak during which stage of the assault cycle? Answer is 2. Crisis stage. The nurse is taking care of someone who has a history of violence and aggression. He is participating in level 1 intervention. What is the goal of this level? Oh, by the way, level of intervention is in page 292, table 25.3. You see the levels of intervention for anger. So level 1 is to prevent violence, right? The goal for level 1 is to use active listening skills, remain calm, speak respectfully, listen carefully, establish and maintain a trusting therapeutic relationship. Do not argue, challenge, or correct. Level 2 is to protect, right? Protecting the client, yourself, and others from potential harm. Suggest a timeout in a quieter but safe place. Keep the client talking. And level 3 is to control the violence. Client is now out of control. So protect the client and others through seclusion, restraints, and injected medications. So again, please know these levels of intervention for anger when we're dealing with patients is actually having this episode. Okay, as a healthcare provider, we need to know what are the levels of interventions and what's the goal during those levels. Level 1 is to prevent violence. Level 2 is to protect. And level 3 is to control violence. So let's go back to this question. The nurse is taking care of someone who has a history of violence and aggression, and he is participating in level 1 intervention. What is the goal of this level? Answers 3, establishing and maintaining a trusting relationship and therapeutic relationship. Question 5, the care provider is trying to deal with an angry male client. She takes a deep breath, remains calm, and introduces herself to the client. She also should do all of the following as well, except answer is 4, acknowledge the anger with the client. And that is the summary of chapter 25, anger and aggression.